Hello and welcome to Sheila Lives Out Loud. My name is Sheila Moniga. Thank you for finding my channel. Please click subscribe and hit notifications, then catch up with me every Monday for a brand new episode. So it's been about 2 weeks since the curfew was lifted in Kenya. Yani, we have waited months, but I don't know how your behavior patterns have been. I tried to go out, but I just couldn't do it. I really tried, but I couldn't do it. But the one thing that I really did enjoy doing, and I still enjoy doing, is taking a drive by night. To see this Nairobi city by night, it's really quite something. And clearly, guys are enjoying. But is that the way to go? Is that the right steps? I have so many questions for our guest today. We're joined by Dr. Simon Kigondu, the Secretary General of the Kenya Medics Association, and we're going to talk about life post-curfew. Note, post-curfew, not post-COVID, post-curfew. We're also going to talk about some whisperings that I've been hearing concerning vaccinations, pregnancy, and miscarriages. It's so many things that we are going to unpack in today's episode. So please watch it to the end and share this conversation with a friend. As always, it's great to hear from you. So let me hear your comments. Drop a comment in the comment section below right after you've watched this video and shared it as well. Hello, Dr. Simon. How are you doing?
Yeah, nice to see you again. It's been a relief that curfew is lifted a bit. So it's both a relief and a caution, so to speak.
Yes, it is. So we're going to start with the good news because, difficult things, you need to build up into them. So let's talk about post-curfew, not post-COVID. What's the way forward and what has your experience been?
Yeah, it's been, as we had earlier alluded to, what should be done at the times when we are on so-called lockdown. Is that we should increase our education to the population on what needs to be done to avoid COVID. And secondly, we should increase our vaccination rate. And we are happy to note that the Ministry of Health and indeed the private sector have taken up an increase in advocating for vaccination. We have noted that a lot of the institutions where we go, they have taken up COVID measures. Even some of the hotels and aeroplanes, so to speak, and ports of entry where we are entering and moving out of, have taken up the measures as prescribed by the Ministry of Health and other health bodies. So that is important. So what we are saying is that curfew has been lifted, but COVID is still around. So the aim is to vaccinate more and at the same time also do preventive medicine by washing hands, wearing masks, and that has been shown to decrease the transmission of COVID, seeking treatment early when necessary, and again, improving vaccination rates.
Okay, speaking of vaccinations, we now have a variety of vaccines that are available in Kenya. I know earlier in the year we got the AstraZeneca, and I think that's the one that you got. I know for sure it's the one that I got. And last week I posted on my social media about the effects, what I experienced from, of course, pain in the arm to early menses. And a lot of other people were sharing their experiences. But now we've got Moderna, we've got so many different vaccines available, and everyone seems to have their own specific and unique experience. So what variants do we have when it comes to the vaccines that are available, not just in the private hospitals, but in all public hospitals across Kenya?
Kenya took up a vaccination policy, and we began to import many of the vaccines. We also have donations, so to speak. So the initial vaccine was the AstraZeneca one, and that was the initial one. There was also Sputnik, so to speak, in that time when there was a bit of confusion here and there of whether they should be bought or not. Then came the others also started coming in. We got donations also from, for instance, the USA, where a lot of what they were using was the Moderna, and the Pfizer has also come in as one of the later ones. We also got from China one of their vaccines. And we can say that we are in a situation that we had envisioned that we wanted to be in, where there are many, there's a variety of vaccines for us to choose from. We also thank the Ministry of Health for ramping up the vaccination campaigns. As you've seen, they've even gone as far as going to churches during the weekends to encourage people to get vaccinated, and there is more availability down to the health centers. For instance, if you go to Kegumo Health Center, vaccines are put down there, and the variety is being improved depending on purchases and what is coming in also as donations, grants, and all are welcome. You have seen that there is a call by past presidents from the bigger countries to have vaccines airlifted to the places in need if they are in excess in their countries. So this is what is important.
Okay. Now, when it comes to administering of the vaccines, we know there's some that are just one shot and then a majority that are two shots. So just walk us through each one and how many jabs before we talk about booster shots.
Yeah, so the one-shot vaccines are the Johnson's and Johnson's vaccine. And as we say, those are viral vector vaccines. The two shots as prescribed are there is the AstraZeneca, the Chinese Sinovac, and also the mRNA vaccines such as Moderna and Pfizer. So that is the prescription that is given. So what happens is that studies are done to see if the vaccine strength, so to speak, is maintained. Are there antibodies? Do the people who have gotten the two shots faring on well, or are they falling sick? Do they need a booster? So these are scientific studies. And as we have said, because COVID vaccination is a new entity, new knowledge comes in daily. And it has been shown that actually the vaccine is decreasing the severity of illness. Other studies have also shown a benefit of having boosters. And as the science evolves, I suspect that we will be having recommendations of boosters. What may not come out now is what is the duration of the booster. So, but we can see that the direction of booster is going there. And some of my colleagues are even thinking of doing a mixed match, meaning that we got the two AstraZeneca, we may go for Moderna as the booster. But these are scientific studies that are going on. But so far, we have seen that the vaccination schedule of the vaccines that have been administered is actually working. And we are happy with that.
Okay. So before we begin to treat ourselves and take ourselves to health facilities for boosters, can we all kula relaxa? If you've had your first jab, your second jab, wait for instruction before you go to take up a jab that could have gone to someone who doesn't even have the first one, right?
Yeah. So that is encouraged, that you encourage those who have not been vaccinated to actually go and get at least their first one, because not the population, target population to be vaccinated has not been reached. So there'll be definitely someone who will require that first vaccination.
All right. So talking about pregnancy, there have been conversations concerning vaccination and pregnancy. Some women are claiming that they have had miscarriages as a result of being vaccinated. So the question begins, is there a right trimester? Should pregnant women get vaccinated in the first, second, or third? And does it have a bearing on the pregnancy?
So the reason why COVID vaccination in pregnant women was initiated was because when COVID got the pregnant women, then they had severe outcomes. And we have even had pregnant women who have passed on as a result of COVID infection, it seems that pregnancy and COVID they aggravate the severe disease, and hence the reason why an advisory was given as to vaccination of pregnant women. Once this vaccination was initiated, then it is important, as you have said, for any adverse outcome to be reported. And the adverse outcome being reported forms a body of knowledge for us to find out as to whether there is a causal relationship between COVID vaccination and the reported adverse outcomes. So, for instance, first trimester miscarriages occur already even before COVID and COVID vaccination in about 25% of pregnancies. So if someone, for instance, gets a COVID jab, then maybe loses a pregnancy, then you want to capture that knowledge, but not necessarily attribute it to the vaccine. But when you have a large body of knowledge of people reporting probably the same thing, then we may start a process of trying to attribute that cause as the causative agent. Now that's even before the vaccination was introduced, for instance, in this country, the vaccination had been done in the other countries on pregnant women, and the data that had been collected had shown that there was no significant adverse outcome attributable to the COVID vaccination. So it is important for anyone who may have had a vaccine and had an adverse outcome to see the doctor, and so that we can also try to attribute these and also collect a body of knowledge to see. But currently, as we speak, my clients are vaccinated, some even in first trimester, and so far, so good, so to speak.
Right. So for anybody who experiences any adverse effects, and it's not just about miscarriages, but anything else, to please report it to wherever you got your shot from, and so that this knowledge can be put in documentation as part of an ongoing research. We are all lab rats now. For want of a better name, we are all subjects. We are all under a big experiment, and we're hoping for good outcomes when all is said and done. So, Daktari, going forward, I have to tell you something. On a light note, there's a new word that's been added to the dictionary this year, and it is called super spreader. That is an actual grammatically correct word. I love that this year has given us fantastic new words, including super spreader. Now, we know that as a nation, we're going into elections. So super spreader events, kibao, ndio hizo, loading. Your do's and don'ts as we go forward, post-curfew and into the holidays.
Political rallies have been known to be super spreader events, and without fear of repeating why political rallies are super spreader events, for instance, as opposed to church services and all, is that they are almost uncontrolled gatherings of large masses of people who are more likely to break the rules set by the Ministry of Health. You see, when people are seated, for instance, in a religious institution, they are wearing their masks, they're not hugging, they're not clapping, they're not shouting. There is a priest at the front there. Then they are doing hand washing before entering the place. This is not replicated in political rallies, where the politicians make a very nice point and everyone is clapping, shouting, hugging each other, or handshaking and all. And the venues for political rallies are areas where there is no soap and water, there is no running water, and they would probably be in areas where the vaccination percentage is low, and those are the super spreaders, really. And we really need to be very awake to this reality. Part of the so what we are saying is that they definitely will happen, but we need to really take precaution. The advice to to people who may not necessarily want to get COVID is, one, to avoid such political rallies, and maybe for politicians, they can take it upon themselves now to start organizing rallies on online platforms, on social media platforms, just to try to minimize these contacts with people. So super spreader events are mainly uncontrolled. There are rules and regulations that need to be monitored for the same. So that would be my advice. And for politicians who want to have people in their rallies, and we would urge them to ensure that the government is well funded to buy vaccines and vaccinate everyone who wants to come to the rally.
Right. Yeah. What about traveling up country? Do we have the green light to go see Shosho and Babu, or do we still stay put?
Waves of COVID are dictated now specifically by the variants that seem to be spreading faster than before. So the advice to that is to ensure that the grandparents are actually vaccinated. I was at Kegumo Hospital in Moranga County, where I saw some of the elderly. The hospital is doing well in vaccinating some of the elderly there. It has a large elderly population, and many of them are actually aware of vaccination and getting vaccinated. Secondly, we need to spread these vaccines to the really, really down areas, over and above the major hospitals, to the clinics which normally vaccinate the children, and get those people vaccinated. And the people traveling now to see their grandparents, it's important they get vaccinated and spread that message. Then they can visit the grandparents. Yeah.
Fantastic. Thank you so much, Dr. Simon. As always, it's wonderful to touch base with you and to catch up with you and hear your thoughts, even as you advise us on the way forward. It's been a great journey walking together, and we still continue. I'm sure I'm going to chat with you just before Christmas to find out what your plans are going to be. And, it's just nice to keep in touch with people. If there's one thing COVID has taught us, ongea na watu. Ongea, talk to people. Don't be alone, and don't be a stranger to yourself. We're social distancing, yes, but we're still people. Sindio?
Exactly. And also, so it's important because I also got my 17-year-old vaccinated. I think it is, now that Moderna in America is given to 12-year-olds, then we just get the boy vaccinated. People who play sports, people who mingle in schools, I think it's also important to have them vaccinated. So people can look into that and get their teenagers sort of vaccinated.
Okay, awesome. Another nugget right there. Thank you so much, Daktari. It's always wonderful to catch up with you. I wish you all the very best. And thank you to you for watching this episode. Please click subscribe and hit notifications. Exercise caution. We're not out of the woods yet, and with the holiday season loading, we need to do even more to take care of ourselves to see the new year. We've been through so much. Hey, it's been 2 years of wow, what was that? Let's get over this year. Let's have a wonderful holiday season and kick off the year with great things, with great expectations and great opportunities too. Until next week, Monday, stay safe and live out loud in all that you do. Bye for now.